So tell us some of the major challenges with disclosure of health information today.
Major challenges is basically understanding how the information has come into the electronic health record and the various source systems to make sure that the real legal record has been defined. And then also when you are working with an electronic system, the print cues that are associated with that to assure that if this person's been assigned a print cue, that the same person over here has been assigned the same print cue, so you're getting the same consistency out of the process. Same consistency also in issues with authorization validation. So it still comes down to a people issue. You still have to have trained individuals that are looking at the authorization to make sure that it's valid, but they also now have to go to a technical level of understanding how to extract that information from an electronic record.
And what's the risks if they don't do this? I mean, what are the consequences of making what are the consequences of not doing good data governance with your information?
The data governance usually has to occur from the facility. We will work with that facility also to ask those questions. For example, the EMPI, the Enterprise Master Patient Index. How do you identify a patient? One of the questions I will always ask when I'm talking with a customer is, what is your MPI error rate? And if it's anything higher than 2%, you know there's issues, because the best practice is anything less than 2. So if it's high, then there's going to be an issue from the fact that we will have to take more opportunity to do quality control checks and validate. So our man hours and our time involved in that process will be increased. And then we also have to share that risk back to the facility. So we're looking at those components, because if we have that quality control, we're always giving that back to the director or the manager that's over the release of information process, so they would know you've had 2 patients that were merged, or you've had an overlay of patients. You might have had a junior and a senior and they got mixed, which is a dangerous situation. Or if you've got multiple, maybe I was Rita Bowen, I was Rita Smith Bowen, and then maybe they had me as Rita something else at some point, and I may have 3 different patient records, and so there's not a consistency, and you pull that one, you don't have the full history. So that's the biggest risk, is knowing how to research that patient, and when you do find those errors, getting them corrected quickly and working with that facility.
Thanks.